Hello, welcome everybody. My name is Deborah Anderson, and I'll be your host for today's webinar. As a reminder, this webinar is being recorded. The webinar is titled Including Pre-K and Comprehensive Early Childhood, Early Childhood Care and Education Systems Building, or ECCE. And as the title implies, we're going to discuss how states are expanding options for parents, strengthening their ECCE systems by creating opportunities for pre-K programs to be offered in a wide variety of settings. Joining me today to present is Dr. Lori Connors-Tedros, who is a Senior Research Fellow with the National Institute for Early Education Research, or NEAR, and a nationally recognized expert in pre-K policy administration and funding. Dr. Connors-Tedros is also a consultant with our PDG B5 TA Center. And also joining us from the center are Howard Morrison and Sierra Norwood Williams. Howard will be supporting a discussion today, and Sierra is providing tech support for this webinar. If you have any tech issues, we're all encountering some today. There's something in the air with Zoom. If you're able to, please put any questions in the chat and we'll try to see if we can help you. Most importantly today, we have leaders from New Jersey, New Mexico, and North Carolina joining us to share their experiences on implementing pre-K in their states. I'll introduce our state speakers when we begin the state panel discussion. Before we begin, we have a few housekeeping reminders. Next slide. If you haven't done so already, please change the name on Zoom to share your first and last name and identify the state that you're from. It's important that we know who's in the room, and it will help facilitate networking. Just please follow the instructions on the screen. Also, please be sure to keep yourself muted unless you intend to speak. We'll have some opportunities later for that. So, but for the time being, please keep yourself muted. Next slide. Here's how to change to connect your phone to your name. But again, follow the instructions on the screen in the event you called in addition to joining your computer. Click on the switch to phone audio and then follow the instructions. Next slide. The objectives for our webinar today are to identify barriers and solutions for implementing pre-K within the context of the comprehensive early childhood care and education system. We hope that you'll increase your knowledge of systems building strategies for pre-K expansion in order to support an equitable system. And we hope that you'll also learn from other states on how they support pre-K in mixed settings through financing, workforce supports, inclusive practices, and data systems. Next slide. We are grounding ourselves with a few definitions before we begin so that we're all on the same page with terminology throughout the webinar. First, we are using the definition of pre-K as developed by NEAR, and it was in the State of Preschool 2021 annual report. And you'll notice that when we refer to pre-K programs, we're talking about programs funded, controlled, and directed by the state, serves preschool age children, focuses on early childhood education, group learning experience that is at least 2 days a week, distinct from subsidized childcare and programs designed to serve children with disabilities. And when pre-K is blended with Head Start, the state funds must substantially increase the number of slots. Next slide. We're also using the ESSA definition for mixed delivery to describe the combination of programs, providers, and settings such as Head Start, licensed family and center-based childcare programs, public schools, and other community-based organizations in which a pre-K program may be delivered. Next slide. Finally, when we are referring to the comprehensive ECCE system, this includes core mixed delivery programs of children, of childcare, early Head Start and Head Start, state-funded pre-K programs, and programs supported by Title I of ESSA. It also includes broader programs and services, which are home visiting, IDEA Parts C and B, Family Support Program and Services, health and mental health services, and nutrition programs. And it also includes the infrastructure components that support these programs and services, part of which we'll be talking about today are those important infrastructure components. Next slide. We have a poll that we would like to get a better sense of how your states are focused on pre-K in mixed delivery systems. The first question asks which settings are allowed through policy, either legal or administrative, to deliver pre-K programs in your state. You may check all that apply. And again, this is what do you have in policy that allows programs to deliver pre-K. If we didn't have an option for you and there's something else that is occurring in another situation in your state, please list that. And if you're unsure, please place your comments in the chat box as well. And then the second question asks, which settings are actually delivering pre-K in your state? To distinguish from there may be something that's allowable in policy, but pre-K is not actually being delivered in that particular setting. And so which settings are delivering pre-K? We have a few states that have joined us that don't have a state-funded pre-K program. So we hope that this will be a beneficial webinar for you in thinking about strategies for implementing. Quite a few of our respondents are saying that childcare and family childcare homes and local education agencies are allowable in addition to Head Start. So seeing a pretty mixed group of responses of where it's allowed to be delivered. Which settings actually deliver? Have a pretty good response rate on that, where again, we're seeing relatively mixed settings between childcare, LEAs, and Head Starts. Give everybody just another minute or two to answer the poll. I have a couple of, okay, let's go ahead and close the poll and show the results. Are we seeing the results?
Yes, we saw the result of one poll.
Okay. Those don't show on my screen, so my apologies for not being able to look at the. Okay, good deal. So you can see there's a pretty good mix of, again, center-based, LEAs, Head Starts. A few states don't have state-funded pre-K. And then we have a couple of comments from Colorado. The new universal pre-K will be launching. So it remains to be seen where they're going to actually be delivering pre-K. Technically allowed and delivering in Minnesota, but only a handful of childcare actually deliver pre-K. And so again, a little bit of discrepancy between what's in state policy and where pre-K is actually delivered. All right, so let's go to the next slide. And as you can see, this again is from the NEAR report from 2021. The majority of states do serve preschoolers in public school programs. There's a lot of factors that drive which settings in states where pre-K is delivered, and state legislation and funding streams have an awful lot to do with that. As you indicated in your poll questions, not all settings are authorized to directly receive funding to administer a pre-K program. And so what we're going to share with you today are leaders from New Mexico, New Jersey, and North Carolina about how they've offered pre-K programs in mixed delivery settings and what kinds of policies they had to tend to in order to be able to provide that. When we're able to provide pre-K in mixed settings, this does provide additional choices for families. And so we want to highlight their work and maybe think about how implementing pre-K, expanding pre-K in the more comprehensive system can be a benefit to families. So next slide. We're going to talk just a little bit about how pre-K is part of comprehensive ECCE systems building. Next slide. Before we get into that discussion, we're interested in your perception of barriers that you've experienced in your state in implementing or expanding state-funded pre-K. So if you don't mind putting in the chat, we'd just like to hear from you about what are some of the roadblocks that you're bumping up against in your efforts to implement more pre-K in your state. Maybe you've had barriers around reaching or increasing access for specific children. Maybe there's geographical barriers. What concerns are you being heard from families, providers? What kind of support do you have from leadership, governors, heads of state agencies? So we're getting some good feedback, hearing some things about funding, political will, legislation, funding, some workforce kinds of concerns. Power within the LEAs. Again, more workforce credentialing for teachers. Teacher shortages. Thank you, you guys. These are great. All right. In my community, sometimes language or lack of communication about the program is a type of barrier. And so I think lots of good and diverse issues that you're facing. And I think that the rest of the webinar, we hope to be able to think about how some systems planning might be able to help you think about how you're going to address some of these barriers in addition to what we're going to hear from our states. So let's go to the next slide. These are, we could spend all day on this. And I think that we're going to hear more about some of these strategies as we talk to our states, and certainly in Lori's presentation. I wanted to just kind of take things up to the balcony view of thinking about your comprehensive system and what are some things to consider that might help address some of the barriers that you've talked about. And so I'm just going to run through these kind of quickly. One of the strategies in thinking about alignment and access and information can be coordinated enrollment. And so collecting and integrated data in order to monitor capacity of mixed delivery programs is definitely a systems level strategy that many states are thinking about to ensure that they get children and families with the right fit for the programs that they need, and ensuring that there's the availability and that families can find where there's programs that are accessible. Thinking about ways to set policies can be to think about family share of costs through CCDF. There's a lot of attention about family share of costs in terms of families being able to get full day, full year supports, and thinking about how pre-K can be a part of that full year, full day system of support. So as states are planning how to best support families of 3 and 4 year old kids, bring pre-K into that conversation of thinking about how that can be better incorporated. I didn't see too much in the barriers, but frequently we hear that as programs begin to receive funding for pre-K programs, there's a concern that it's going to diminish capacity for serving younger children. And so it's really important that you think about financing structures that are thinking about all kids in all settings. And there's a lot of creative things that states have done in order to provide some infant toddler incentives for programs that are also providing a pre-K program within their setting. It's important to think about comprehensive transition plans. So I know a lot of the PDG states have been focused on transition. And if children are in a setting that will be changing, or they're in the same setting and they're transitioning into pre-K programs, it's just important that your transition planning thinks in a comprehensive way. Creating plans around the workforce. This is not just a pre-K discussion. It is an entire workforce discussion that's important in your systems planning, that you tend to thinking about how to support and retain that high quality mixed delivery workforce. Developing and aligning standards ensures equity across programs and best supports mixed delivery programs. And so it's not just aligning standards for 3 and 4 year olds, but it's thinking across the mixed delivery system. Coordinating mixed delivery program monitoring. And I know that some frequently is a burden on providers who may have multiple monitoring requirements based on their funding streams. So at the state level, at your systems planning, you could be thinking about how to streamline those. And then finally, think about how some of those embedded services such as food, developmental screening, health, mental health services can be embedded across all mixed delivery programs. Those help focus on the whole child, and those are important to have across the system. Building political will and addressing legislation is certainly a bigger challenge. If you can get some of these things worked out, it might give you a better package to take to help build that political will, that this is about all kids birth to 5, and expanding pre-K is one strategy that's going to help make things better for kids and families. All right, let's go to the next slide. And at this time, I want to introduce Lori Connors-Tedros, and she's going to provide us a little bit more information about scaling pre-K in mixed delivery settings while building the system. So Lori, I'm going to turn it over to you.
Thank you so much, Deborah, and welcome everybody. I'm really happy to see folks from so many different states and communities, actually. We have folks from the local level. So I'm going to try to set a bit of a context around thinking about scaling and expanding pre-K in the context of a birth to 5 system. So Howard, you can go to the next slide. This slide's from the National Academy, Transforming the Workforce. And I always use this slide personally to remind myself of what the system is like for children and families. They have to navigate all of these different services, often that don't exactly make sense, that feel chaotic or inaccessible. And that's why we have so many children falling through the gaps. We often talk about the purpose of our systems building work as being efficient in aligning state government, And those are all very important goals. But fundamentally, what it is really about is the children, thinking about children's experiences first and the continuity of their experiences, birth to early elementary, is really critical for learning. So while yes, we are focused in this workshop on pre-K, we're always thinking about the child that's coming from the infant toddler program, experiencing preschool in multiple settings, and then going into early elementary. And what could we as adults do to make that experience seamless, high quality, and positive, if you will. And that's really the purpose. The purpose of our systems building work is to really create a system where no child falls through the cracks. You can go to the next slide. This is some of the data that we reported, as this past year in the State of Preschool Yearbook. Now, this does reflect the impact of the pandemic, and state-funded pre-K as childcare, as everything was impacted quite significantly. But fundamentally, we know that very few children actually attend pre-K, and we have significant racial and equity gaps. Study in Pennsylvania showed that of their childcare system and their pre-K system, showed that African-American young children were more likely to be attending the childcare program, which was of lower quality. We see similar findings in New York City. So while we all are seeking to ensure that every child has access, we really have to pay specific and intentional and focused attention to the equity issues. I think there is some hopeful signs for the future from the perspective of the pandemic really showed us the importance not only of childcare, but of early education. And it also showed us the importance of parents' role in delivering that early education. A number of states, we were all disappointed that we didn't get Build Back Better, and we haven't gotten yet additional federal dollars to expand access, but about 15 states or so, and I've been hearing about more and more each day now that state legislators and budgets are passing, are putting funds to not only expand pre-K, but to expand childcare payments, to expand home visiting. So there are hopeful signs of growth, and that's why it's a really important time to think systemically about the policies and practices we put in place to support children birth, I'm going to say through third grade. As Deborah mentioned when she showed that slide about where children are being served, all but one state that has state-funded pre-K allows mixed delivery settings. The one state that does not, Hawaii, that's because of their constitution. So it's really important to think about the legislation and what allows at least the opportunity and the authority for mixed delivery settings. We'll talk more about what actually operationalizes that and what needs to be put in place to actually support that. Certainly including family childcare in state-funded pre-K is a new opportunity. We released a report last year. I'll talk more about that in a couple of minutes. But about 40% of the kids, even though if funding goes to the public schools, still about 40% of kids are served in non-public, which is kind of the umbrella term we use for Head Start and community-based. And there are differences, for example, in Alabama and New Jersey, their legislation and program guidelines require mixed delivery. Similarly, in West Virginia, they require at least 50% of the programs to be in mixed delivery settings. Other states like Michigan mandate about 30%, New York mandates 10%. So as you can tell, I was using different language, differences between requiring and mandating, kind of set up the foundation, if you will, for what actually can happen on the ground. So let's go to the next slide. Thank you, Howard. As I said, we've been doing quite a bit of work to really think about expanding pre-K in the context of a mixed delivery system birth through third grade. And there are some states that are really, somebody could put their mute on, there's some background noise. But the first and foremost that's important to think about is that to see pre-K as one piece of a strategy to support children and young children, and actually an opportunity to lift up and strengthen the infant toddler system. So there is really some unique and interesting opportunities to do that. I'll just give you a couple examples really quickly, but in Oregon, with their preschool promise, they are giving a slightly higher rate to support pre-K children if the program agrees to serve a certain number of infants and toddlers. In Rhode Island, they have the commitment and the policy for mixed delivery, so they provide coaching to non-public programs so they can be financially viable and see how they can support it. In New Jersey, Tanya will, I'm sure, talk about the per child rate is greater for non-public programs to account for some of the differential costs. Deborah already mentioned the high quality workforce. I saw in the chat about the barriers. NEAR and the research does support having a BA and specialization in early childhood education as providing the highest quality. Now, we are in a unique and challenging situation because of the workforce issues, in every profession, but also as a result of the pandemic. I know Tanya will speak about the fact that this doesn't happen overnight. A lot of support has to be provided to providers in order for them to meet the qualifications. And I just saw yesterday, Virginia is thinking about piloting like a rapid kind of credentialing program so that people that are working already but don't have the credentials can get it. Very, very critical. I tried to highlight what I thought was like the most important things to pay attention to. Really important to provide some start out and planning costs. As you know, it takes more in the beginning. It takes more to get the right materials, even for childcare that we just did a study in a state looking at a variety of early childhood centers and really looking at the amount of developmentally appropriate materials, the play materials, the imaginative play, the outside space. Thinking about how do we deliver good quality practice, it is actually through the environment and through materials. So really thinking that through and provided programs, particularly those in community-based settings and schools who really need that support. Some states like Illinois have special funds for facilities. Some of you mentioned that as a challenge, and that is a kind of a reality in a lot of communities. We believe very strongly about including children with disabilities and dual language learners. There are some states, Kentucky, for example, Colorado has in the past really prioritized and offered differential funding for serving children with disabilities. And there are a number of, well, a small number, but a number of dual language and bilingual programs for young children, which is like the best time to have that. And parents love that. And parents will pay tuition for that. So it's a great strategy and great for children. One of the struggles we face at NEAR, and I'm sure you all face every day, is that we don't have the data systems to actually know well who is being served, what their background characteristics are, and how we can use that data to drive the resources to those communities or children that are most in need. So those are some of the things I would say that you'd really want to think about as you're thinking about expanding quality pre-K to ensure equity and alignment across the birth to 5 system. You can go ahead to the next slide, Howard. Someone just put in the chat that Erickson they did a webinar shortly before ours on family child care in state pre-K. NEAR and Erickson have some special funding from Homegrown, who are experts in family child care. And we are really thinking hard and carefully about family childcare in state pre-K. We know that parents often prefer family childcare, and it may meet many families' needs, not only for the preschool child, but for other children. However, we always want to stay focused on what is a quality experience for children. And so we're in the process of doing a literature review, and we'll be engaged with many stakeholders in defining equivalent standards of quality. Fundamentally, what drives how we expand is holding to a line that we want children to have a safe but good quality experience that supports their learning and development and health. So we'll be working on that. A number of, as I think we said before, a number of states allow family childcare, and New Mexico will be speaking in a minute. However, there really needs to be a lot of intentionality around building the capacity of family childcare, understanding the complexities of their business model and service model in order to allow them to, and to support them and be successful in participating in the state pre-K program. There are a couple of cities that do a pretty good job. San Francisco, who was very intentional in their design of their program, serves about almost 18% of their children in family childcare. Oregon's Preschool Promise program serves about 12%. And then there are a few other states, Arizona about 3%, Seattle about 3%, and Philly about 2%. But for the most part, this is our next frontier, if you will, and an area that I think a lot of folks, as someone just put in the chat, are working pretty hard to both think about what makes sense for family childcare while holding to the standards of quality. So we can go to the next slide, Howard. What we've been doing work, and with actually some really fantastic state teams from Rhode Island, Minnesota, and Washington over the last year. We had a peer learning community. We're doing a study of 6 states and looking really closely at their mixed delivery system and how they support that, what contributes to that. So here are some of the things I'd like to leave you with as you go to the state panel and listen. I know you're going to hear this. One is to have a clear vision. You could call it a strategic plan. You could call it a bold goal, but really to think about how does expanding quality pre-K fit for your vision for children. I'm going to say birth to 3rd grade. Some states are looking birth to 5. But thinking really clearly, everybody in the PDGB5 community has a strategic plan and are working on the multiple levers that help move a comprehensive system forward. Shared governance, one of the best around not only pre-K, but childcare, Head Start, early childhood special ed. I know, obviously, we have some in the audience in New Mexico will speak about it, that have a new governance structure for early care and education. Alabama is on the line. Colorado is coming, has just established and will be implementing. But you can also do this without changing the government structure. And the shared governance and leadership, I typically use West Virginia because they have a shared leadership model of, while funding, it goes to school districts at the state level. All the policy decisions are made by a leadership team that includes Head Start, childcare, special ed, and the State Department of Ed, and that is mirrored at the county collaborative level, where they also have a similar kind of broadly representative team. And I do think that shared governance, both across at the state level and intentionally shared between state and local, as Louisiana has, Virginia has, a number of other states now are building these local governance structures. And those, to me, that infrastructure and bidirectionality are most likely to get us a comprehensive early childhood system that is inclusive of all and equitable. And then, as we all know, change doesn't happen overnight. first of all, if we don't change the system, we're not going to get different results. So we really do, that's, I think, the purpose in a way of the PDGB-5, but this all takes time. It took West Virginia 10 years to get to universal and more than 50% being served in collaborative settings just for their pre-K. But it certainly takes time. I know all of you said funding, and that is true. However, creative funding and thinking carefully about how we could coordinate funding and blend and braid funding to ensure that children are served holistically, and the program's not driving the service, but what children need and children and families need holistically is driving what we can do. So I'm going to conclude there so we have plenty of time. I'm going to leave you with this. Our ability to do kind of an effective early care and education system, and particularly pre-K, begins with legislation, decisions that are made about what is mandated, what is regulated, and how program and policy and guidance supports that. It's sufficient funding, but not only sufficient funding, how that funding flows in a timely way to support providers, and what we do about quality, setting one standard for all and ensuring that each sector and system and program and setting has the resources they need to implement quality. I know this is really hard work. We are so humbled by the work that's happening in the States, and I'm really excited to hear from New Mexico, North Carolina, and New Jersey, and for you to hear and for us to hear your questions. So thank you so much for allowing me to share some of the work we're doing.
Thank you, Lori. The last 30 seconds, all of your remarks were fantastic, but the last 30 seconds, I think, really sums up where we are and what we hope to continue to talk about through the rest of the webinar. We are now going to move into our state panel. I'm going to introduce our amazing speakers here in just a second. I do want to call your attention to the fact that each state represents a different path and structure for administering pre-K, and we selected these states based on the diversity of the agencies that they work with and for, and how they make that work in their state. As Lori said, every state has a little bit different path. Not one strategy is going to work for each state. And so we hope that you glean some things from the strategies being used by these states to help you in thinking about your implementation and expansion. We have a set of questions that we're going to ask our panel members, but we do encourage, if you have questions, we have about 45, 50 minutes that we will spend on the panel. And so if you have some questions that you would specifically like to address to one of our panel members or also to Lori, please put those in the chat. We'll monitor those. We'll kind of do a combination of the questions that we have prepared, but we also want to be sure that we're meeting your needs today with questions that you have. And so now I'd like to introduce our distinguished panel of representatives, and I'm going to start with Tanya Costin, who is the Executive Director for the Division of Early Childhood Services at the New Jersey Department of Education. From June 2021 through June 2022, she's also served as the Acting Assistant Commissioner for the department. Her division includes the Office of Preschool Education, Kindergarten to Third Grade Education, Head Start Collaboration, the Governor's Council for Young Children, and several state interagency programs and partnerships centered around early learning and care for young children. In her role, she oversees all aspects of implementation for the state's preschool programs, including development of program standards, fiscal planning, and contracting. She supports partnerships and collaboration work done by the Council for Young Children, Head Start Collaboration, and the Head Start Collaboration Director. She earned a Bachelor's of Science degree in Education from Penn State University, a Master's of Science degree in Counselor Education from Syracuse University. Also joining from New Jersey is Kimberly Friedel. who has served as Executive Director of Preschool Education at the New Jersey Department of Education since October of 2019. And with her team, she's responsible for the implementation of state-funded preschool programs. She was part of the team that developed the infrastructure for the former Abbott preschool programs in the past. She holds a BA in criminal justice from the American University, master's degree in education from Marymount University, and has taken educational leadership courses at Rowan University that led to the issuance of elementary teacher, principal, and chief school administrator certificates. In her career, she has also served as a preschool teacher, federal child care center director, an elementary teacher, and an adjunct professor in early childhood education. For all of our panel members, I'm sharing just a bit about their backgrounds because I know you'll join me in understanding the diversity of their backgrounds and where they sit today within their state system. From New Mexico, Sandy Trujillo Medina is the Director of Early Care and Education and Nutrition with the New Mexico Early Childhood Education and Care Department, which has oversight of pre-K, child care, and family nutrition programs. She has an extensive background in Head Start, beginning as a Head Start teacher and advancing to director level positions at the community and at the state level with the New Mexico Head Start Association, where she served as the president. And from North Carolina, we have Dr. Christy Lee Snuggs, who is the Deputy Director of the Division of Child Development and Early Education and she's been in that role since 2018. She's the lead for the Preschool Development Grant, Birth Through 5 in North Carolina. And the division is responsible for child care regulation, QRIS, North Carolina PreK, and subsidized child care. Dr. Snuggs has an extensive background in higher education and also with Head Start. She received her doctorate degree in educational leadership from East Carolina University, master's degree in child and family development, and bachelor's degree from Appalachian State University. And last but certainly not least, Lorena Gonzalez is the senior manager of the early education branch, which is part of the Division of Child Development and Early Education with the North Carolina Department of Health and Human Services also. She provides leadership and oversight of the statewide North Carolina pre-K program, serves as a subject matter expert for all assigned contracts, strengthens relationships with both internal and external stakeholders and community leaders to implement and monitor and evaluate early childhood education and pre-K services. Ms. Gonzalez holds a bachelor's degree in sociology from Salem College and a master of education in early intervention family support from the University of North Carolina at Chapel Hill. Again, we have a diverse panel today who are going to share their state experiences with you. So panel, we're going to turn it over to you. And I think we'll take down our slides. All right. So we're going to begin. And we're going to start with New Jersey. We're going to take this first question in alphabetical order, and then we're going to mix it up a little bit. And again, if you think of questions throughout their presentations, please put your questions in the chat. But for New Jersey, and Tanya, I don't know if you're going to start us off, but can you please provide a brief overview of your state's mixed delivery system, the results and approaches to your system, what percentage of children in your state receive state pre-K in mixed settings, and what in your state policy or legislation allows you to provide those services?
Good afternoon. Thank you for having us. And Kim will jump in for anything that I may have missed. So we started almost 25 years ago building our state-funded preschool program, for many people will know as our former Abbott districts. That was through court order. So with that, part of that court order to create preschool services for 3 and 4-year-old students in those communities, it was a requirement to work with every willing and able Head Start and child care center. This was easy to implement because the court decision came out in May of that year, and programs had to be up and running in September. So districts clearly did not have the capacity within their own buildings to serve the basically two new grade levels of children. Many of them were offering some preschool services, but now they have been mandated to basically serve all 3 and 4-year-olds within their community. So it was a rapid scale up. That was then followed up through administrative code, where we had guidance and information about rules, regulations, and regarding the partnership and the funding of that partnership. We've continued that partnership as we continue to grow our state-funded program. And under our current governor, Governor Murphy, who has made it a hallmark of his administration to expand preschool throughout New Jersey. We continue to look back over our lessons learned during our early years of our former Abbott program to really continue to grow and move the message that mixed delivery is what is best for children and families. We continue to support that in our regulations. We continue to support that financially. So there are different differentials. So when we place children in an in-district program, there's one rate. When we place children with Head Start, there's another rate. When we place children in a licensed childcare provider setting, there's a third rate. Those rates are also done by geographic region. So obviously they're slightly higher in the north than they are in the south, but we do take all of that into account to ensure that we are fully supporting this partnership. Some of the hallmarks that we do talk about that Lori did mention, all of our teachers who are in state-funded preschool have all of the same credentials, and we've continued to work to ensure that teachers in Head Start and child care centers are paid parity to their local school districts counterparts. We have struggled in some ways with that because we do pay enough salary-wise, but where we tend to have struggles is meeting healthcare benefits. Obviously, even though we pay at a high rate to cover healthcare, what a school district who has 2,000 employees can actually do with their pot of money versus an independent childcare center who may only have 10 employees is completely different. So that is an area of challenge that we continue to see as we expand our program, and we've always seen, but we continue to kind of keep that on our radar. We also continue to work collaboratively with our sister organizations, especially the Department of Human Services, because they have been doing a lot of work around incentivizing infant toddler slots. And we have been working with some of our legislators who are also putting out new legislation around infant toddler care and the funding for that, because that is a big issue as you go to expand in preschool. Infant toddler will be affected. We see it in the fact that New Jersey started to regulate teacher certification up through for those serving preschool children at the age of 3, but we had less regulation what was happening in infant toddler. So many teachers who were in infant toddler programs left to go to preschool programs because now there was higher pay, and there was basically an avenue for there to actually be a career in preschool more so than there was in infant toddler. There was a path forward for education. There was a path forward for higher pay. So clearly those are areas you have to look at when you're looking to expand preschool at a universal level. Also, because we were paying a significantly higher rate for preschool children than we were for infant toddler children, we had providers who then converted slots from infant toddler to preschool to get a higher reimbursement. Also, New Jersey, like many states, we have a very strict ratio for infant toddler care, which makes it very expensive. So centers started to look at a financial situation for themselves, and they saw it was more financially beneficial to serve preschool students than there were for infant toddler. Thus, these are conversations we've been continuing to have with our sister agencies of how do we move the needle forward so that we are supporting a high quality system birth through age 8 and not just starting at 3. So those are some of the things that we in New Jersey had to look at. Kim, if there are other things that I may have missed.
So I'll just share our percentages and where they're served. So currently we have 55% of our students in district operated classrooms. We have 35% in provider, licensed childcare providers, about 8% in Head Start, and about 1% in charter schools. And we are currently serving a little bit over 66,000 3- and 4-year-olds.
Thank you. Is there one solution or strategy that you would like to share that you're most proud of about your system?
I think one of the things, and this is really just kudos to Kim and her team, who are basically the boots on the ground. I mean, we have been very focused and committed to this journey for 20 plus years. And like we said in Kim's bio, Kim was here when we started our preschool journey, and she returned back to continue to build it. It is about relationship building. We spend a bulk of our time really getting districts to understand the value of partnering with Head Start and childcare. We also spend a great amount of time advocating for that partnership and really looking at how to move it forward. So as we are updating our regulations this time around, we are really focused on making sure districts have to contract with all willing and able Head Start programs to make sure those children are served, as they represent our most neediest population. And when our code has to be updated by 2024. We're going to be running groups, collaborative groups with our communities to really focus on how we can make the collaboration better with licensed childcare. We definitely want to get to a point where the system is looked at that is high quality, regardless of where your child sits, but more importantly, that this is not about ownership of a program, but this is a collaborative program where parents understand the value, as well as school districts and legislators understand and see the value of a holistic system for young children. And I think the work that we have done through our Council for Young Children, our interdepartment planning group, which represents the state agencies, and the work of Kim and her team, we have done a great job to get New Jersey off to a great start for what is a journey that I may long be retired when it is universal preschool, but I definitely can say I'm proud of it. And I have 2 great preschool graduates from New Jersey who I call my children. So.
Thank you, Tanya and Kimberly. And I think your point around working with the legislation continually is a good lesson to states, and excited to see how your work collaborating with childcare goes. So keep us all posted, definitely. All right, we'll ask you some more questions after a little bit. So Sandy, would you like to give us an overview of New Mexico's mixed delivery system and what kinds of things you all have implemented in your state?
Of course. So New Mexico PreK currently provides services throughout the state in public, charter, or private schools. We also provide services through Head Start, private child care centers, family child care homes. We recognize that parental choice is the key in the mixed delivery system. And this has been beneficial for families because it meets the needs of the families while minimizing transitions for children and families through the provision of continuity of care. So of course, if a family has older school age children and there's a preschool site available on site, that makes it obviously more accessible for them. Hours vary, location varies, and so we want to leave that choice up to the parent. We also provide services through our home providers, faith-based programs, Montessori, Reggio, our tribal partners, and our community providers are able to support culturally, linguistic, appropriate, and early childhood education. So a lot of the things that we've been doing from when universal pre-K started in the state of New Mexico, initially it was just for 4-year-olds. Within the last several years, funding expanded to include 3-year-olds, which we call early pre-K. We have a couple of options in how our pre-K model is delivered. We have 4-year-old classrooms. We have, of course, as I mentioned, our early pre-K, which consists of 3-year-old classrooms. And then we also have a mixed classroom, which would be a 3- and 4-year-old classroom. So providers have the option to apply for the pre-K model that they would like to implement that's going to best meet their needs. In terms of looking at pre-K collectively and how it was funded years ago, the community was brought to the table to include private childcare providers, Head Start programs, the school districts, to talk about how pre-K could be implemented within the state. When it originated, the decision was made to provide 2 funding streams, one through the Public Education Department and one through what was our Children, Youth, and Families Department, which used to initially oversee pre-K in the state of New Mexico. So these 2 funding streams were fairly equitable in terms of the amounts that were distributed through each funding stream. And of course, at that time, the public school funding stream funded our school-based programs, and of course, our community-based programs were funded through CYFD. Now, in the last couple of years, since the development of our early childhood education and care department, the legislation now has changed oversight of New Mexico PreK all to ECCE. So that means that ECCE oversees not just the community-based sites, but our school-based sites as well. So this is a transition that we've been working on. It's relatively new right now. What we had seen in the past was that there were addendums or differences in implementation from school-based programs to community-based programs. And what our focus is right now is to streamline that into one New Mexico pre-K, because that's ultimately what we are. So we're aligning our systems, looking at curriculum, looking at our program standards, and making sure that we have one set of standards for everyone that participates within New Mexico pre-K. In addition to that, we've had several new initiatives with the focus of improving quality, and again, looking at that equity and consistency through school-based and community-based providers. We also have a pre-K parity program for our community-based educators, so that if they have the same credentials as a school-based educator, they are eligible to receive that equity of pay. We also have scholarship programs that have been implemented to try to encourage our childcare providers to further their education, get their AA degrees, their BA degrees in early childhood education. Recently, we just supported a stipend program, which our secondary institutions applied for. And what this is going to do is it's going to allow the universities to give a stipend per semester to early childhood education students to help cover any costs that scholarships don't cover right now. And let's see what else I have here in my notes for you. In terms of our mixed delivery system and how many we are serving, overall New Mexico is currently funded for 14,175 children within the state. Of that 14,000, 11,203 are 4-year-old slots. 1,924 are 3-year-old slots, and then we have 1,048 mixed age slots. We serve pre-K through 78 school districts within the state. We have 217 community-based programs, and those community-based programs, as I mentioned before, are inclusive of our faith-based programs, our Head Start programs, our family child care programs, and our tribal programs. In terms of family care home providers, which I know is what we really wanted to talk about today, or there's a lot of interest in that. I think we can stand to improve our numbers in terms of how many home providers we can get to participate in New Mexico Pre-K. Oftentimes our experience is that there is a little bit of resistance or uncertainty of how to implement that in a home-based setting. Oftentimes the providers feel like they need to have certain pieces in order to be able to do that, but we're here to help them. And so through educating them, exposing them, and connecting them to things like Wonder School, which helps our providers understand the business aspect of providing services to children, that provides an additional support, which is available to all of our licensed providers right now. I'm not sure if I missed anything there.
No, that was great. And we might want to pick your brain a little bit more about your family childcare homes a little bit later. And if the audience has any specific questions about that, we can dive a little bit deeper. And Lori can chime in too, because I know that's a strategy lots of states are looking at. If you could highlight one strategy that you think has made the biggest difference in success, what would you say that is?
I would say in the last few years, through the support again of our governor, Michelle Lujan Grisham, and our current Early Childhood Care and Education Department Cabinet Secretary Gruginski, their vision and their focus is really on quality and this mixed delivery system and how we make it accessible to all of the children and families within the state of New Mexico. So all of these new initiatives have been, I think, our greatest contribution to help seeing this move forward in terms of our strategic plan and full transparency, and just really educating our community with monthly calls for our providers in the community to one-page information sheets that are shared with our legislators to keep them in the loop as to what's going and what outcomes we're having take place as a result of this funding and how it truly benefits the children and families. So again, we definitely have the support of our leadership in our state with a tremendous mission and vision. And I think because of that, that energy obviously trickles down, and we're really excited about what's yet to come.
Fantastic. I heard commitment and communication is two important things. So thanks so much. All right. Next, we're going to turn things over to North Carolina. And Christy, are you going to kick us off?
Yes.
Okay, take it away.
Deborah. Good afternoon, everyone. So happy that North Carolina is with you this afternoon, and I'm going to kick us off, and then I'm going to quickly turn this over to Lorena Gonzalez, who is the director of our NC Pre-K program in North Carolina and can answer all of the questions that any of you might have. But I want to give a little bit of a historical perspective. And I really want to go back to Lori's comments around clear vision, shared governance, and attention to time and capacity. In North Carolina, we have been very fortunate over the past several decades to have governors and legislators that were committed to early childhood, especially at the governor level. So much so that we've had a clear vision in North Carolina for over 25 years of early childhood being a priority. And I say all of that to say that that's how our NC Pre-K program came to fruition. It actually started under the auspices of our governor's office. And it was developed there, and then it moved after that. It has sort of had different places that it has lived. It moved to the Department of Public Instruction in our public school system. And then 11 years ago, it moved over to the Department of Health and Human Services Division of Child Development. So we have had NC Pre-K very similar to New Jersey for over 20 plus years. And of course, it is evolved and changed over time. And I think it only is continuing to become more and more impactful to the children and families that it serves. If I think about a clear vision, it really started with that leadership and the legislation and the ownership of the governor to really believe and know and understand the need of those early years and why NC Pre-K was so important. Our program was actually designed from infancy as a mixed delivery system. It was intended, it is a 4-year-old, it's an at-risk 4-year-old program. It was never intended at the time of development to be fully universal. It was one strategy, but would serve those at-risk 4-year-olds. It's mixed delivery as far as the settings that it's in, and Lorena will talk to you much more about those details, but it's also mixed delivery of a state and local level. It was designed to be state funded, but also to have a local commitment so that locals would have a, buy-in into the actual program. And so while there is not a set amount of local funding or local contribution, there is the expectation that there is a local contribution to the program as well. In addition to that vision, there's also an early childhood action plan, which is our strategic plan for North Carolina, which was actually implemented by our current governor. And in that plan, it says that all North Carolina children from birth through age 8 will be healthy, live and be safe and nurtured in environments that are safe and nurturing, and that all children will be learning and ready to succeed. And under that strategic plan, there are specific goals. And one of our goals for North Carolina is that we will serve 75% of the eligible at-risk 4-year-olds in our NC PreK program. We are currently just above 50%, so we still have a way to go in serving all of those children, but it is an area that we are continuing to work on. As far as it is a shared governance as well, I mentioned to you the different places that our NC PreK program has lived, but right now it is under our Division of Child Development. We are the child care administrator, state administrator. We oversee, as you heard in the introductions, all licensed childcare. And so when I think about shared governance, while we operate the program, we work very closely with other state partners. We have a state level advisory committee made up of those joint partners, our Department of Public Instruction, folks from the governor's office, as well as licensed childcare and so forth. So we have this advisory committee that helps us to govern the program. And then that is mimicked at the local level because there's a shared governance component at the local level. There's a local governance advisory committee, NC PreK advisory committee, that has to be co-chaired by the superintendent of the public schools, as well as one of the executive directors of the local partnership, which really oversees the implementation of NC PreK in our private sites. So there's even that shared governance at the local level. And then the only other thing that I want to say, and then I want to turn it over to Lorena, is that we have also thought about the funding. And while our program originally was set up with state funding and funded predominantly through state allocations, it is now much more diversified. We have state allocations that fund our NC PreK program, as well as lottery receipts. And we also have federal funding in the form of TANF and our CCDF funds that help to support our our NC PreK program as well. So we have a very unique program, I think, in comparison, but also one that is extremely popular. I kid with Lorena a lot that it is one that is on the hot seat at all times. It is highly political. It is an area where we've seen over and over again great outcomes for children, and many, many people want to have input into that. One thing that I will say as part of our PDG grant, North Carolina, of course, is a PDG grantee. We are looking to strengthen our early childhood continuum. And while we have a strong NC PreK 4-year-old program, we are undergoing a infant and toddler cost and feasibility study. So going back to that idea that a lot of times NC pre-K programs or pre-K programs diminish the capacity for serving younger children. We want to ensure that that's not happening in North Carolina, and we want a coordinated system across the spectrum of 0 to 5. So with all of that being said, I'm going to turn it over to Lorena to tell you more about the specifics of the program. Lorena?
Thanks, Christy. I'm not sure who's manning the slides, but if we could just move to the next slide, please. And Christy already spoke on most of this, but this is basically just to give an overview of our program. As Christy mentioned, we have mixed funds, mixed funds for our program. I was waiting for the animations to finish. We have funds from lottery, we have state funds, and we also have TANF funds for our NC pre-K program. We serve all 100 counties of North Carolina through 91 NC pre-K contracting agencies, and that is a blend of both public and private agencies, just as Christy mentioned earlier. And this visual down here is just to give you an example of those public and private agencies that administer these contracts and provide services in their counties. What's unique about us is that 3.3% of our contracting agencies are administered through Head Start programs, and that happens usually in smaller counties where there's a unique situation and public school and or a partnership doesn't exist or is unable to provide services as an NC pre-K contracting agency. A little over 43% of our contracting agencies are administered by the public schools. And then our largest contracting agencies are administered through local Smart Starts or local partnerships for children throughout the state. And if we could go to the next slide, please. And overall, this is just a visual percentage of the children that are served throughout the state. 52% of our children are served in public schools. Next, we have 36% of our children that are served via private childcare programs throughout the state. And then 12% of our children are enrolled in Head Start programs, in NC pre-K Head Start programs. And I'm not sure.
I would just add there, we serve a total of roughly 30,000 children. I know it varies from year to year, but it's right around 30,000 children that we serve. Correct. And one other component is that all of our NC pre-K programs are required to be licensed, and they have to be a 4- or 5-star facilities, which are our higher quality centers in North Carolina.
Thanks, Christy. Deborah, I'm not sure if we answered all of the questions that were in part 1 before we move. Yeah, our last slide is challenges and strengths, and I know we're not there yet.
If you want to go ahead and talk through those while we have them pulled up, and then there may be additional questions for you about those later. Thanks.
Okay, we can do that. As you see here, we just kind of listed out our challenges and strengths in North Carolina as it relates to NC pre-K. Our challenges are the number of children in the state that are available. And this is in no real specific order, but they're the ones that we thought were the most important to share, and we wanted to be transparent as well. The number of children that are available to serve. We have several local, I guess you could say, non-NC pre-K affiliated programs that are popping up throughout the state that kind of affects enrollment across all entities, NC pre-K and non-NC pre-K programs. So we're looking at that being a challenge. We're also dealing with teacher compensation. That was mentioned previously, and I'm sure that that's something that's happening throughout the country. It's no different in North Carolina, and it's something that we're addressing. Our rate structure as well, although that's been in place for quite some time, it's something that has been a source of, well, I guess a challenge for us. I was going to say a source of contention, but it can be a little difficult. It can be a little divisive, and it can be personal. based on the amount of the rate and who gets that rate versus Head Start versus public school versus private childcare. So that's something, again, that's a challenge and that we continue to constantly address at the state level for our program. Another one that, another challenge of ours is, and I guess no different than across the state, is challenging behaviors. And that's something that we saw kind of increase, especially the last couple of years during the pandemic. And so we're seeing that being a real challenge for us and how to address it and be more flexible to programs to support them. And then we have communication. And I hesitated with that one there, and Christy and I spoke about it a little bit, but again, we wanted to be transparent. Communication, you know, we have great partners and great collaboration, and we do a good job of communicating, but sometimes the lines do get a little fuzzy or a little blurred. Communication isn't always seamless, and so we will try to work really hard in terms of being able to communicate at the state level to the programs, to the local level, even down to parents and families in terms of our program, what it means, what our services are. And so that's a challenge for us. On the flip side are our strengths. And although I said this is in no particular order, I think one of our strongest ones, and I'm sure Christy would agree, one of our strongest strengths, if that makes sense, is our teacher licensure and professional development. As Christy mentioned, she touched on teacher, I think she touched on teacher requirements, but our NC Pre-K teachers are required to have their birth through kindergarten, or work, they either have to have or be working towards their birth through kindergarten degree. We also, we have a unit that works very closely with our NC Pre-K program. It's our EES unit, and that stands for Early Educator Support. What that unit does is they work with our local programs that are providing NC Pre-K. They work with the teachers that are hired with those programs to support them and assist them through that licensure piece of NC Pre-K. That team works together with our Department of Public Instruction to make sure that our NC Pre-K teachers get their licenses. In combination with that, we also collaborate with two universities in the state, East Carolina University and the University of North Carolina at Charlotte. And they provide, we contract with them to provide mentor and evaluator services to our lead NC Pre-K teachers as they're going through licensure. So we feel really proud of that. We're often looked at as a model for that piece of our work with NC Pre-K. We've had other local non-NC Pre-K, non-Pre-K programs kind of model their programs after us, especially in relation to teacher licensure. So we're really proud of that. We've been able to increase rates for private sites. That's something we consider a strength, because that's something we definitely want to continue to see as a strength and be able to provide funding that's appropriate and well, enough funding for our, well, across the program, but specifically for private sites. And we've also been able to increase admin funding. And then lastly, there's our pre-K to K transition. And I'm sure we'll probably touch on that a little later too, because I think this will pop up in our response to other questions, but we're really proud of the work that our state team and our local teams and our teachers and administrators across the state have been able to do in terms of strengthening our pre-K to kindergarten transition, and just the collaboration and the work between the Division of Early Childhood and the Department of Public Instruction in North Carolina has been able to do to make this successful is something that we're just super proud of. Christy, I don't know if there's anything you want to add there.
I'll wait until we get to other questions. So I'm sure I could add a lot more about that.
Thank you so much, Christy and Lorena. And
You're welcome.
Great overview of the work that you're doing in North Carolina. I think what we're going to do is move, and Howard's going to pose a couple of questions from the chat, because I want to be responsive to our participants. So Howard, let me turn it over to you, and we can have about a short response from each of our states to some of the questions. So Howard.
Right. Thanks, Deborah. So one of the questions that came in was about, has anyone collected sample provider agreements for state-funded pre-K from around the country? It did look like one of the, there was a response to that, but just wanted to see if others wanted to touch on that.
I did drop the link to where people can find New Jersey's template that we use for LEAs to contract with Head Start and private child care centers. So, and it sort of explains our role in overseeing that process.
Thanks, Tanya.
So Howard, in North Carolina, we, as Lorena described, we contract with the local contracting agency. We do not contract with the actual provider. There is a subcontract then that happens from that contracting agency that then is with either the Head Start site, the public schools, or with the private childcare. So ours is multi-layered, if you will, and we have a contract that we give with the contracting agency, and then the contracting agency then turns around and subcontracts out that work to the actual provider.
Thanks, Christy.
Right. Thanks, Christine. Another question that came in was around, can you speak more about serving children with IEPs outside of the public schools?
So in the state, so with New Jersey, we do encourage all classrooms that are contracted for preschool for them to set aside seats for children with IEPs, because clearly this gives them an opportunity for those children who are 3 through early intervention to have the opportunity to be placed in a inclusive setting, you know, an inclusion setting instead of self-contained because I happen to turn 3 in December. So we do encourage our districts to work with early intervention. We also encourage when children are not, once they get identified with an IEP, that they do not get moved to an in-district location, but services are provided in the location that they had originally been assigned. So we do work with them and our preschool special ed people here at the Department of Education to support districts in that effort.
That is very similar for North Carolina. One of the eligibility criteria for our at-risk
Christy, you're on mute.
I didn't touch anything. How did that happen? Okay. It is very similar in North Carolina. One of our eligibility criteria for our program is around children with IEPs. So we do encourage that. And as a result, what happens, there are developmental screenings that are also required. And then we identify children. This is a way for us to identify those children who maybe don't have an IEP, but maybe are suspected that they need additional referrals. So we work with our public schools, very similar to what New Jersey just shared. We work with our early childhood exceptional children that then provide those services in site at wherever the children are enrolled. Lorena, would there be anything you would add to that?
No, ma'am, you covered it.
I can just say for the state of New Mexico, our model is very similar to what has been described by Christy and Tanya. Services on site, working with the public schools, creating that collaboration, memorandums of understanding to ensure that the children are getting the services they need.
Thank you. I wanted to note that, hang on. Rebecca has provided some information about what they're doing in Vermont. And I want to encourage any of you, a lot of you have some great strategies that you are implementing in your state. If you have any links or resources that you want to share, please put those in the chat. This is also about learning from each other. And Lori, would you like to address, say a little bit about the link that you just posted?
I would, and then I wanted to we have time, talk about that curriculum question, because I think that is a barrier that's not always talked about. But I just put a link to a set of tools that were funded actually by the Gates Foundation. There's a very good work there talking about, they worked with 3 states over time to really create some systems change in the implementation of expanding and improving their pre-K program. But then various folks were contracted to develop tools that could be helpful for others. We developed some to address the agency capacity to implement high quality and to work with partners and community organizations to implement mixed delivery. There's some really good tools on alignment in the system and building relationships. But if we have one more second, the question around curriculum is very, very important and very challenging. So one of the near benchmarks is that states are implementing the early learning standards that is aligned to their curriculum and assessment. I think that the challenge around, for many states, some states do require a research-based curriculum and have a set of approved curriculums. All well-researched and effective curriculums use play as the vehicle for learning, but there's just a lot of confusion in the field and a lot of misunderstanding around what needs to happen for children in their day in order for that to be a high quality, safe, both safe physically and safe emotionally learning experience. So I think that's best said for another time. But I think Christine is on here in New Hampshire, and I think New Hampshire has some policy around the use of play, and I think Minnesota is exploring that as well. But it is a very important, one of the big barriers and causes of I don't know whether it's dissension or not, is the fact that in early childhood, we believe in developmentally appropriate practice, in a focus on play as the vehicle, the strategy for learning. So I would say that that's something to talk about another time. I don't know if I answered your question, and others on the call, Tanya and Lorena and others might want to respond to how you're supporting from a state level the use of a good curriculum aligned to your standards that is delivered in a developmentally appropriate way.
Can I just say, so we do have aligned curriculum in New Jersey to our standards, but I think one of the things that we also have is within the programs, they have to have an instructional coach, or we've called them master teachers. And those are staff who go into the classrooms and coach the teachers on implementing the curriculum to ensure that the developmentally appropriate practices, play-based, the emotional, we call them preschool intervention referral specialists who also coach on social emotional learning. So I think in addition to the developmentally comprehensive research-based curriculum, we also have coaching supports.
All right. This could have been a 3-hour session. We've had so much great feedback from the states. Again, we know that many of you all are doing some wonderful work. If you're interested in connecting with any of the states that presented today, and you happen to be a PDG state, whether you're renewal or non-renewal, contact either ACF or the TA Center, and we can connect you to get more information. In summary, I'm not going to spend any time on this. Systems building is important. Expanding access is an equity imperative. And we have some, on the next slide, we have some resources that will be available when the webinar is published on our website. You will be receiving an evaluation. Please complete the evaluation survey. Your responses are very important to us as we continue to plan and share webinars in the future. Thank you for hanging with us till the end. Hope everybody has a wonderful day. Thank you to our speakers and all of you who shared your great comments today. Bye.